GE. It is suitable for general family viewing.
Welcome to another Thursday where Body Garage, the art of well-being, will bring to you health discussions. And today we have one doctor here, a specialist, the E.N.T, ear, nose and throat, and he is going to talk to us about the basic things that you need to understand. So join us as we dig deeper into this discussion. Karibu sana.
Thank you.
You're welcome. Now, before we go into what has brought us here today, for the sake of our viewers, I would like us just to know who you are and what kind of services your specialty offers to the people.
Thank you for asking that. I'm Dr. Sherendra Namdar. I work as a consultant E.N.T surgeon at M.P. Shah Hospital. I have 16 years of experience in E.N.T field. Our E.N.T center deals with basic E.N.T pathologies, basic E.N.T issues up to advanced E.N.T things, something like a super specialty E.N.T center.
Mm-hmm. All right. So the E.N.T stands for ear, nose and throat. Is that right?
Yeah, that is correct. I need to make a small correction.
Yes.
Initially it was E.N.T. Now we call it E.N.T and head neck surgery. So it includes ear, nose, throat. Mm-hmm. It includes other fields also like eyes or surrounding tissues, the nasolacrimal duct. Mm-hmm. It includes the vesicle, which is the neurosurgical field. Mm-hmm. It includes the thyroid surgeries also. Includes the parotid surgery also. Mm-hmm. So that is neck. Mm-hmm. And in children we also do bronchoscopies, rigid bronchoscopies to remove the foreign bodies. So that will include the chest physician and pediatrician field also. Yeah. That's quite vast.
Mm-hmm. All right. That's quite. So right now it's E.N.T plus head
neck surgery
and neck surgery.
Yeah.
All right. That's good to know. So let's go right into the discussion of today. E.N.T. We will start there. The nose. I think the common things that people might be asking themselves, what we hear people calling sinuses. But maybe the right word would be sinusitis, right? So what does this entail?
Yeah, when somebody tells or when the patient comes to us saying he has sinuses, basically he means he has the issue of sinusitis. Now when we think of sinusitis, we need to understand the basic thing first. Mm-hmm. So what are sinuses?
Yes.
Sinuses are mucosal lined cavities lying in our skull. So they have basically had three functions. They make the skull lighter. Mm-hmm. So the skull is light because these are air-filled cavities. Mm-hmm. They are lined by epithelium, mucosa, mm-hmm. So which removes the dust particles, the harmful particles, bacteria from the inhaled air, and it filters them. Mm-hmm. So it acts as a natural air conditioner. So the air which when we inhale and it is filtered through the sinuses, when it reaches the lung, it is warm and humid, mm-hmm. free of harmful particles.
All right.
Additionally, they add resonance to our voice. Mm-hmm. So you must have noticed when you have a severe cold or a sinusitis, mm-hmm. your voice appears flat. When you are talking to people, mm-hmm. People will tell whether you have a cold or a sinusitis because that resonance is lost because the sinuses are blocked. Mm-hmm. So they do also an important function of adding depth, resonance to the voice.
All right. So where are they exactly located? Because sometimes people will say, I think I can see there is a problem with sinuses. Where are they? Can we see them from outside?
Sinuses are within the skull, so we are not able to see them from outside. Now, unless somebody has a very big tumor or a very severe sinusitis, everything is swollen. But normally, we are not able to see the sinuses. Mm-hmm. We will see them only if they have some serious pathology. Mm-hmm. Yeah.
All right.
They are located in the skull. So there are 4 pairs: ethmoid sinuses, maxillary sinuses.
Do you mind just pointing to us, like if you can?
Yeah. So this is the frontal sinus. They are in paired sinuses. So this is the frontal sinus, which adds to the our frontal prominence.
Yeah.
Now there is ethmoid sinuses on the medial side of the eye. There is anterior ethmoid sinus and the posterior ethmoid sinus. Anteriorly, when we have pain around the eyes, usually the ethmoid sinuses are the one, those are affected. So these are lying medial to the eyeballs. Now these are maxillary sinuses on the cheeks. So somebody has very prominent cheeks, he has a big maxillary sinuses.
Okay.
Maxillary sinus infection also can cause teeth pain, because the root of the teeth, sometimes they can lie bare in the floor of the maxillary sinus. And then there is a sphenoid sinus. It lies quite posteriorly, so you cannot check it clinically. It is you can see its opening either on endoscopy or you can see its appearance on the imaging, like either X-ray or the CT scan of the sinuses.
So the times that you can see sinus is when an X-ray is done, or CT scan,
Or endoscopy.
or endoscopy.
Yeah.
We can't see it with our eyes.
Yeah.
From outside, that is.
Yeah, imaging is like we see the radiological imaging, the dimensions, whether how is the lining, how whether there is any pathology. Endoscopically, when we put the endoscope in the nose, we are able to see the opening of the sinuses. Basically, not the whole sinuses, the opening of the sinuses.
Yeah.
But in surgical patients, like when you have removed the opening of the widen the opening of the sinuses, you can see the interior also, like inside of the sinuses.
All right. So that is the sinuses. Now let's talk about the sinusitis. What is this now?
Yeah, the term itis, like conjunctivitis, sinusitis, rhinitis. Itis denotes inflammation of the involved organ.
Yes.
So when we say sinusitis, it is an inflammation of the lining mucosa of the sinuses. So it can be a pansinusitis, like affecting all of the sinuses. It can be limited to one sinus, like a maxillary sinusitis or a frontal sinusitis.
Yeah.
It can be one-sided, it can be both-sided.
Yes.
Okay.
Right.
Now, when you say sinusitis, commonly the term is used to denote a viral rhinitis, viral rhinosinusitis, or a bacterial rhinosinusitis. Additionally, there is an allergic rhinosinusitis, there is chemical rhinosinusitis, there is bariatric trauma, like when you are when you are diving in deep sea, or when you are descending in a flight and you already have a cold, the sinuses lining can bleed, causing a barotrauma. So those are different types.
All right. And that also helps us to understand the causes. What are the possible causes of this inflammation of the sinuses?
Yeah, that is important. Common thing is the common cold, which is caused by adenovirus, rhinovirus. Commonly, like you must have noticed, when the children start going to school, they have a lot of sinus issues, adenoids, common cold, flu, and those children, they bring that virus to home, and everybody in the family is sick. So viruses are the commonest cause. Secondary, bacterial infection because of various bacteria like H. influenzae, Haemophilus influenzae, pneumococci, streptococci, sometimes staphylococci. Those are common bacteria that can also cause.
Yes.
Now, chemical sinusitis usually seen in people exposed to chemical fumes, working in chemical factories or in toxic environments. Pollutants, like when you are exposed to airborne pollutants or dust, fumes from the vehicle, petroleum vehicles, those also can damage the mucosal lining, causing sinusitis.
Yeah. So from our environment, we can talk about things like dust.
Yes, very common.
All right. What about smoking?
Yeah, smoking. Yeah, smoking either actively, like you are a smoker yourself, or a passive. If somebody close to you also doing smoking, that can also act as a chemical irritant, causing the sinusitis.
All right. What is the relationship between cold, when the environment is cool, not the common cold, and the sinusitis now?
Yeah, extremes of temperature that can reduce the ciliary activity, mucociliary activity in the lining.
Yes.
So that can induce sinusitis. So when we are in extremely hot temperature or extremely cold temperature, that can cause the issue with the mucociliary lining activity of the sinuses, that can cause a sinusitis. So you will also notice, when the weather is very cold, people tend to have more cold issue with the cold, the rhinitis, and secondary sinusitis.
Yes. All right. That sounds good. So, any particular drugs that may predispose to this?
There is one thing I have always noticed, that people use this nasal decongestion drop. I cannot tell the brands, but you go to the pharmacies, you use the brand. They are good nasal decongestion, but what they do, they reduce the activity of the lining, the mucociliary lining. So what happens? You are making the mucociliary lining more exposed to the airborne bacteria or viruses, so that can cause. So nasal decongestants, topical nasal decongestant, which are available over the counter, they should not, I will say, they should not be used without a doctor's advice, or at least not to be used for long duration. Maybe for few days is okay.
Alright.
Normally I will say 5 days is the safe period to use. If it is not resolving within that period, they should not use it.
All right. Okay. Let's talk about how does a person who has now sinusitis, how do they feel? What are the symptoms that commonly can make somebody suspect probably this is sinusitis?
Sinusitis, yeah. Commonly, it will start with a rhinitis, like a common cold. The person has cold, he's suffering for 5-6 days, he's better. Then again 7, 8, 9 days, he has the same symptoms again, but with more severity, like nasal congestion is there, heaviness in the nose is there, he will be having headache or facial pains depending on the sinus involved. He might be also having a lot of mucus in the throat, especially when he wakes up in the morning. He will feel there is a lot of mucus or throat irritation at the back side of the throat, or the area where the palate touches the posterior pharyngeal wall.
Yeah. All right. So if not, you said the symptoms of the cold plus headaches, facial pain.
Yeah, but in a more severe way.
In a more severe way.
Yeah.
And they are recurring. They keep recurring.
Yeah, now there is a difference between an acute sinusitis and a chronic sinusitis. Now, common presentation is an acute sinusitis. So, majority of the people, they will be better without any medicine. Just a simple adequate hydration, maybe taking steam.
Yes.
They will clear themselves without even going to the doctor. Some people, because of the anatomical issues or lining issue with the lining of the mucosa, they will be having these issues again and again. So if it is lasting for more than 12 weeks, we term it as a chronic sinusitis. So the pathology is different, and even the treatment modality is also different for acute sinusitis and the chronic sinusitis.
More than 3 months.
More than 3 months, that is 12 weeks.
You just mentioned a few of it, but what are some of the ways somebody can relieve themselves at home when they're having these symptoms?
Yeah, the best simple remedy, home remedy, one can use the steam inhalation, or adequate humidification. For babies, we can humidify the room using room humidifier. Also, you can use the simple saline nasal drops, which are available over the counter. Saline adequately cleans the nasal mucosa. It improves the function of the natural mucociliary clearance. So that those are quite useful. There are certain medicines like syrup ambroxol available as an over the counter that liquefies the mucus, that can be used. For me, I will advise against the use of antibiotics without a proper diagnosis, because you might be having a viral sinusitis. If you are using the antibiotics for that, it is just going to reduce your immunity. So it is always better. Maybe for symptomatic treatment you can use basic medicines, but if you feel it is not adequately controlled or the symptoms are severe, better to always to go to the proper healthcare provider and to diagnose it without doing self-medication.
All right, sounds good. I think so much already we've learned about sinusitis. We can move on to the next thing that maybe might be affecting us commonly. Okay, let's look at snoring. We use that word, but we know maybe there are different causes in the background. So let's talk about snoring.
Okay. So usually causes in pediatric age group, we will say up to 16 years, 12 to 16 years are different than causes in the adults, more than 16, 18 years.
Yes.
So when we think of pediatric population, commonest pathology, commonest issue is the enlarged adenoids that reduce the flow of the air through the nose. So when the air is passing through narrow channels, it will make a lot of noise, which we call as identify as snoring. Now for adults, there are multiple causes that might be lying at the level of the nose, that might be lying at the level of the oropharynx, or that might be lying at the level of the laryngopharynx, the back side of the throat. So one has to think in terms of whether the patient is a pediatric patient or an adult patient.
All right. All right. We're going to hold right there as we're going to take a break. When we come back, we explore more a little bit snoring, and then we continue with the conversation. So stay tuned.
You are watching TV 47, the home of untold stories.
There is only one planet in the universe that we know of that can support life. It's called Earth.
Just imagine at our generation wiping out a whole subspecies. Don't you think it's sad?
This world cannot really survive when we live alone. Cannot also survive if lions and rhinos just live alone. We need all the organisms together.
Join us as we get to learn about the animals that live on this beautiful planet every Sunday, 7:30 p.m.
You are watching TV 47, the home of untold stories.
Welcome back. We are continuing the conversation on the general conditions about your ear, nose, and throat. We are going on with the conversation about snoring. So you talked to us about snoring in children. Talk to us about snoring in adults now.
Yeah. So for adults, as I have said, the obstruction can be at 3 levels. Why there is snoring? When the air is passing through narrow channels, it will make the noise which we identify as the snoring. So if we think of nasal causes, deviated nasal septum, the nasal septum which has either moved to the right or to the left is one common cause. Chronic sinusitis is again important cause. Some people have a lot of polyps in the nose.
Polyps.
Yeah, so nasal polyposis can another important cause. So these are the nasal causes.
Yeah.
So one has to identify and then treat it appropriately. Now, at the level of the oropharynx, some people have very long, big uvula. We call it small tongue. Yeah, the
Small
thing
tongue.
which is hanging from the palate. So when the air is, when we are breathing, it can move and present a funny sound. Yeah, and which can be quite noisy. Lateral pharyngeal glands are the mucosal folds which lie on the back side of the throat, on the posterior part of the tonsils. Some people have very prominent lateral pharyngeal bands. So what happens when they are sleeping, those close together, they come very close and they can make a lot of noise. So that is another cause. Rarely very big grade 3, grade 4 hypertrophic tonsils in adults, they can add to the snoring. Now at the level of the laryngopharynx, some people have very thick base of tongue. So the back side of the tongue, either because of its thick mucosa or sometimes very big enlarged lingual tonsils, they can also add to the snoring. Now when the patients come to you with the snoring, it is not the person who is having trouble, but it is the wife or the partner or who comes to you. He is not allowing other people to sleep peacefully.
Yes.
So we do a clinical examination. Like if we think the cause is lying in the nose, we do a nasal endoscopy, we do a CT scan of the nose and the sinuses. If we think the cause is in the throat, we will see clinically how are the lateral pharyngeal bands, how are the facial tonsils.
Yes. So what can somebody do at home if they're having snoring? Some remedies, some practices that somebody can use at home as they wait to see a doctor.
Yeah. As you have pointed earlier, increase in weight is definitely a risk factor causing the snoring. So lifestyle modification in terms which will help in reducing the weight, like more active lifestyle than sedentary lifestyle. That is one thing, and dietary modification. So those two things definitely one should consider before going to the doctor. Secondly, somebody has an allergic condition, treatment of allergy will definitely help in reducing the swelling inside the nose. That helps in reducing the snoring. People who are smokers, smoking also increases the thickness of the tissues, the oropharyngeal mucosa, the nasal mucosa.
Yeah.
So that adds to the issue with the snoring. So smoking should be totally stopped or at least reduced significantly.
Yes.
People who drink alcohol, so when you drink alcohol and when you sleep, the tissues are more relaxed. So it adds to the snoring problem. So also additionally, alcohol increases your weight. So alcohol, if somebody has an issue with the snoring, alcohol should be stopped, or at least you should not take immediately before sleeping.
Before
so you
sleeping.
you should give a gap of around 2 hours before you take alcohol. Like you should not start drinking and then 1 hour you are going to sleep. So that is going to add to your problem.
All right. All right. Now, does the position of sleeping influence?
Some people will notice when they are sleeping on the back, because the falling back of the tongue or the palate, the snoring is more. So you can also try that, changing the position, but that might be a temporary solution.
Yeah. Which is the best position to reduce snoring? Sleeping. Is there any, or
There is a specific position, but although as I have said, when you are sleeping on the back, during your deep sleep, the non-rapid eye movement sleep phase, the tongue muscles are relaxed, they fall back, so it can increase the snoring. So sleeping on the sides might help in alleviating the snoring. So that might be the better position when you have severe snoring.
Oh, great. That's great. Let's move on to the next thing that's maybe commonly heard among parents because it's happening in the children mostly. Adenoids and the tonsils. Let's start with the adenoids. What are these and where are they located? What is the function? And what happens so that we end up having problems?
Adenoids, tonsils, they are lymphoid tissues.
Yes.
So they form a part of a lymphoid tissue called Walde's ring. So Walde's ring is associated with our mucosa. So adenoids are related to the clearing the bacteria, viruses from inhaled air. The tonsils are related to clearing those harmful bacteria or viruses from the ingested, like the substances which we eat or drink. Adenoids are located at the back side of the nose. They are a loose bunch of lymphoid tissues hanging from
behind the nose.
On the back side of the nose.
Okay.
Yeah, that area is called nasopharynx.
Yes.
Yeah. Tonsils are located in the oropharynx, in the tonsillar fossa. Yeah, those are called facial tonsils on the sides of tonsil, in the throat.
All right.
Yep. Okay, just to continue with the previous discussion, adenoids or tonsils are also an important cause of snoring in children. I think that is the commonest presentation the child has when they come to the E.N.T doctor.
All right. So, how, apart from snoring, what else would make you as a doctor, as a specialist, to suspect this is adenoid enlargement?
As a child who is presenting to you with snoring or noisy breathing, a child who has issue with cough at night time,
Coughing at night
time because of infected adenoids, they secrete a lot of mucus. During daytime, the child swallows the mucus. During night time, when the mucus collects and it tries to trickle down the larynx acts in a reflex way. So the child suddenly wakes up with a lot of coughing. So that is another important presentation.
Right.
If the adenoids are big enough laterally, they can press on the eustachian tip, causing recurrent issues with the ear, like an otitis media, an acute otitis media, or a subacute or a chronic otitis media. So that is another important presentation. So additionally, we call it failure to thrive. Failure to thrive means the child either is not eating well, or even if he is eating well, the growth is not good. He is not gaining weight. So otherwise the child is healthy, he does not have any trouble. Only symptom, he might be having some noisy breathing and disturbed sleep, and the parents wonder why he is not getting weight as in comparison to the other children. So failure to thrive is also an important presentation with the enlarged adenoids. With the tonsils, now recurrent tonsillitis is a part of our growing. So somebody gets 1 or 2 attacks of a tonsil infection in a year, that should not alarm the patient. If it is recurrent, like 4 attacks in one calendar year, like in 1 year, the child gets more than 4. That is the thing. Something you have to go to the doctor to address it permanently.
There's somebody who will ask the question that at night they see their child with a lot of foam, frothing in the nose, like it keeps recurring. What could that mean?
No. When the adenoids are enlarged, they are not allowing the mucus to clear naturally. Normally, the mucus from the sinuses or from the nasal cavity, it goes toward the nasopharynx. Either we swallow it or we cough it out. Okay. So when that passage is obstructed because of enlarged adenoid, there is a lot of collection of mucus, and that mucus can cause frothing in the nose. In the mouth, when the mouth is open, because of breathing through the mouth, the excessive salivation can cause frothing in the around the corners of the mouth.
All right, great. Let's talk about the tonsils. And the common issue apart from the enlargement could be maybe the infection part. And this is to the parents who keep asking, why is my child getting frequent infections? And is it because the immunity is low? What can I do? So why do children get frequent tonsil infection?
The tonsils and the adenoids, they have a lot of lymphocyte population, B lymphocyte, T lymphocyte population. They also have a lot of IgA antibodies. Those are surface antibodies that stay on the surface. So any harmful bacteria, virus which tries to enter body either through the nose, like inhaled air, or through the mouth, through food or water, those catch them. They catch them, they process it, and they keep a library. So our immunity knows. So as an adult, we have that library. So body immediately knows this is harmful bacteria, and they are neutralized immediately. In children, until they are breastfed, they have the ready-made antibodies from mother's milk. After that period, around the age of 2-3 years, when they start growing, going to the school, going outside, now they come in contact with newer bacteria and viruses. So every time
body doesn't know.
All right. So every time they come in contact with that, there is an immune response. The body starts. So that we know this is a infection. So the child is febrile. You feel he's sick. He refuses feeding. After some time, when the body adequately controls the infection, he comes to normal. Now sometimes we have to take the help of antibiotics or other medicines to control the infection. So that's how it grows. So it is not something like since your child is getting infection, his immunity is not good. It is actually part of development of our immunity. We are developing that library inside our body.
All right. What are the common habits that make children to get the frequent throat infections?
Now taking too much cold things.
Cold things.
Why? Because it will neutralize, it will reduce the activity of the surface antibodies. That is the reason. When you take something cold soda or cold water, you get, that is different in different people. Somebody might just take a small amount of cold thing, he will develop the infection immediately. Somebody might take ice cold thing, but he will not have that, because it's different in different person.
So cold things.
All right. Oily and fried food also affects the
oily and fried
food.
All right.
So that gives trouble. I will say eating outside food also can contribute to a recurrent infection, because home cooked food is always best under hygienic condition, but that is one of the factors. Some people are also sensitive to sugary things. So they eat something sugary, immediately next day they have the tonsillitis or adenoid infection. So those 3-4 things one should definitely avoid.
All right.
When you are traveling, when the child is going to school, I think keeping him adequately hydrated will help in having a good immunity.
All right. Thank you very much. Let's hold the thought right there. When we come back after the break, we are going to go into discussing about the ear. So stay around.
You are watching TV 47, the home of untold stories. tonight.
Kuanzia siku ya leo tunaanza sasa kipindi kipya ya ukombozi. Tunaanza ile chama chetu ya ukombozi wa taifa letu.
Azimio leaders to kick off mass action protests on 20th of this month.
Get up, stand up.
This as CS Kithure Kindiki warns against violence.
I direct all security agencies to ensure that our security facilities remain protected areas and should not be allowed to become a theater for politics or rowdy and unlawful behavior, including unauthorized access.
Also tonight, what are President William Ruto's options regarding the mass action?
The best thing is to give him support for overtime. If they don't perform, then you have the latitude and the space to critique that government.
Pundits say it's better to seek truce as leaders like Kenya Kwanza dismiss handshake proposal.
I think it is, he has already expressed himself that we need to establish the office of the leader of opposition being paid, or that particular office being taken care of by taxpayers' money, and I think that is the way we should engage.
Plus,
we have witnessed continued theatrics, antics, and maneuvers by criminals who continue to exhibit high levels of impunity.
we are changing tact. Interior CS Professor Kithure Kindiki warns bandits, assures residents of the troubled North Rift region that the government will deal with the criminals.
Unataka kuendeleza the good times? Basi panda GoTV ikupandishe.
You always know what I want.
Ukilipia subscription ya package ya juu, unapewa upgrade to a higher package free. Panda tukupandishe, upate the best entertainment on TV.
This is the last.
Panda tukupandishe. GoTV, love it.
Welcome to Nyali Golf View Residence, where a luxurious accommodation is inspired by the Indian Ocean. This exclusive residential community offers the ultimate in coastal living along Links Road, Nyali, near Mamba Roundabout. With breathtaking views of the golf course, ocean, and landscaped gardens, every moment spent in your home is an experience of tranquility, comfort, and luxury. Every detail of your spacious, fully furnished apartment has been designed with your comfort and style in mind, with open-plan living spaces, high ceilings, and elegant finishes that exude sophistication and relaxation. Experience resort-style living with a wide range of amenities, including a state-of-the-art fitness center, swimming pool, children's playground, 24-hour security, and concierge services. Experience the ultimate in luxury living and golfing at Nyali Golf View. Contact us today to schedule a visit and discover the lifestyle of your dreams. Nyali Golf View Residence, luxurious accommodations inspired by the Indian Ocean.
You are watching TV 47, the home of untold stories.
All right, welcome back. We are continuing the conversation on E.N.T. and right now we are going to look at the ear. So, Dr. what are the common conditions that you see that affect our ears?
The patients having the hearing problems, I think that is the most common thing. The people will notice and come to the doctor. Mm-hmm. But additionally, trauma to the ear or injuries to the ear, wax in the ear, sometimes swelling inside the ears. Those are, I will say, less common conditions.
Yeah. What about the ear infections?
Ear infections, those are, I will say, people having good hygiene or ears are well protected against the infections. There are acute infections in children, there are chronic infections in children, and similar in the adults. So, usually when we say an acute infection, the infection in the ear usually comes from the nose or the throat, traveling through the eustachian tube to the ear, and presents with a lot of ear pain or headache or fever. Chronic infection, usually there is a recurrent, ongoing or on end of ear discharge and hearing loss, associated usually with a eardrum perforation.
All right. So what are some of the habits that cause recurrent ear infections? Some will ask that, does swimming lead to ear infection? Any relationship?
Yeah, it's an important question. When someone is going for swimming, the water goes inside the ear.
The water, okay.
Water, yeah. If he's not taking adequate precautions, like if he's not using the swimming caps or he's not using the earplugs, so that can change the pH, the acidity of the ear canal, making the ear canal more prone to getting either a bacterial or a fungal infections.
Okay.
Yeah. So swimming can make one prone to ear infections if he is not taking adequate precautions, like precautions in terms of keeping the ear properly covered either with the swimming caps or the ear plugs.
All right. So frequent ear cleaning, maybe using an earbud or something, is it good or it's bad?
Yeah, the same way we don't clean our eyes. Eyes clean themselves. Ear also has its self-cleansing mechanism.
All right.
The ear canal skin is unique in way, whatever wax particles there are deep inside the canal, they will come out outside
on its own.
Now, unless now someone uses an earbud and pushes them back. So, using of earbuds is absolutely not required to clean the ear. Ear has a self-cleaning mechanism. Only thing to clean the ear, one can use a soft cotton towel at the time of bath. He cleans outside. Nothing to put inside. Not even for cleaning the ear, not even for cleaning the wax.
All right. It's not encouraged to put things inside.
No, it is quite troublesome, and there is a risk of also causing the trauma to the ear canal skin or sometimes to the eardrum also. So one should not use the earbuds to clean the ear.
All right. Okay. That's good to know. All right, let's talk now about the common hearing problems and what are the things that cause the hearing problems.
Yeah, when we think of hearing loss, basically it means inability to respond to the auditory signals. Like somebody is talking or there is a sound in the environment and you are not able to respond to it, you are not able to understand it. That is a hearing loss. So there are different classifications, different causes. So causes are usually different in children, adults and even old age. It can be acquired, like after birth. It can be congenital, like somebody is born with a hearing loss. It can be a temporary or it can be a permanent hearing loss depending on the causes. So we think of now common causes. Wax is the most important cause. So a simple cleaning of the wax, either syringing or by suction.
Too much wax in the
impacted wax. We call it impacted wax. So if you use earbud to remove it, you are just going to push it deeper, which makes it very difficult to remove and sometimes painful also. Masses in the ear canal, like in Kenya we don't see many, but in cold environments like swimmers, they tend to develop small masses in the ear canal that can cause the conductive hearing loss. So those are causes in the outer ear, like fungal infection, fungal mass also can cause. Now issues with the eardrum, like eardrum perforation, swelling of the eardrum, that can cause. Middle ear infections, acute otitis media, like acute infection of the middle ear cleft in children or sometimes in adult can cause hearing loss. Now otitis media with effusion, like there is a fluid in the ear which has stayed beyond 12 weeks, that is an important cause of hearing loss in children. Again usually happens because of adenoid issues. So how it will present, the child will not say he is not hearing, but he will not be able to speak clearly. You will see the speech is not very clear. So in school, he will not speak certain words like certain syllables like r, l. So those are difficult to pronounce because he is not hearing them because of the fluid in the ear. So one has to examine it properly, and you need to take corrective action if it is lasting for more than 12 weeks. That is commonly misdiagnosis. That is in children. Now with the inner ear, now many children are born with hearing loss, congenital hearing loss that might be moderate, severe or very profound. So that has to be diagnosed early. There is a mechanism to diagnose it early. A simple test called neonatal hearing screening test with photoacoustic emission. We do have it in our hospital, and it's quite inexpensive, but that shows us like even the child on day one of his life whether he is hearing normally or he is having hearing issues. Because what happens, I want to elaborate this issue. A child is born, his counterpart, like somebody at the age of 6 months, 1 year, he's still not speaking any words, he's just making some noises. So the relatives tell the parent, no, he's just slow, he will start speaking lately. 2 years have passed, 3 years have passed, now the time to go to school comes. Now they are still worried because he's not hearing what he's going to do in school when he's not hearing. So when on day one, when you do the neonatal hearing screening test, you know this child has an hearing issue, you detect it early, and then you do the corrective measures. If you just wait till age of 3-4 years, he's growing without the sensory inputs, the hearing. And that is quite devastating when you think of his further life in terms of schooling, education, marriage, everything.
So it's encouraged to get an infant to be screened.
In any child, especially the hospital born or even in periphery, they should do the hearing screening. Even if they think like something is wrong, they should do it. In Western countries, it is a compulsory program. In Kenya, it is less than 1%. 1%. In Russia, it is 100%. Israel is 100%. I will say that those might be technically more advanced countries. Western Europe 100%, US is 100%. In Kenya, it's less than 1%. And the thing is that the test is inexpensive. In our hospital, I think we charge 1,500 shillings only. So the test is very simple. You just put a probe in the ear and we check. Now, and we are 100% sure the child's cochlea is developed. He's hearing well to all frequencies. So something we are going to know at the age of 3, 4, 5 years when the child has trouble. We know on day one, and I will say everybody should do it.
All right, it sounds good. So what are these things apart from the ones you mentioned? Let's look at something like earphones. Do putting earphones going to affect our ears?
That is a common cause of hearing loss in now I will say young age population. If you are hearing more than 60 decibel continuously for more than 20-30 minutes, it is going to definitely cause the trouble with the hair cells. Hair cells are the cells which pick the sound. So if you are doing once in a while, it is not going to cause you long-term trouble. Now you are going to a gym, you are putting music at 60 decibel because you want to do a lot of workout, and you are doing it for 30-40 minutes every day over a period of maybe days, weeks or months. It will ultimately actually it will damage the hearing initially at high frequency, and if it is not addressed properly, it might also come to the speech, the lower frequencies. Now high frequencies are the ones, now we don't notice it early. So using the headphones in an inappropriate way continuously for more than 20 minutes and at high volumes more than 60 decibel definitely damages the ear. Additionally, that is hearing loss is one thing, and secondly, sometimes some people develop noise in the ear, tinnitus. So because when the neurons are damaged, they can start sending the signals to brain haphazardly, so that we feel there is some noise in the ear, and which is really difficult to treat.
So you have constant ringing sound.
Constant ringing sound can happen, and that those are like difficult to treat. So one should not use too much of the headphones. A limited one is okay at low volumes.
All right. What about the club sound, the club music?
The same thing applies.
The hearing is the earphones is closed. But this is just in the open.
No. It is still more than 60 decibel. Anything more than 60 decibel, even for short duration like more than 20-30 minutes, it will make you troublesome. Sometimes it can cause dizziness also. Like next day morning when you are in full control, you are awake, now you notice that your hearing is not good or you are feeling dizzy. So fortunately it is a short term thing because you are exposed only one time, but if it is a repeated thing, that can damage the neurons permanently. So in clubs and bars they use quite loud volume.
All right. Now, second last question as we come to a close. Have you seen a particular pattern of people who come with hearing problems? Maybe specific workers, you can say construction workers or healthcare workers, any particular trends in terms of industry?
Industrial hearing loss is real. People working at airports where there is a lot of noise. Police officers, if they are on a very busy road having a lot of honking, they are constantly exposed to the noise. So for those people, like where it is an occupational risk or occupational hazard, they should do the hearing test yearly to know. As I have said, when hearing loss develops, it usually starts at high frequencies, which are not really noticeable unless you do a proper hearing test. So people in high risk exposure or high risk group, they should do the hearing assessment. On prevention part, they should use the proper earplugs or earmuffs to filter the sound so that loud sound does not reach the inner ear.
All right. Let's talk about treatment. Can hearing loss be treated? Can it be cured?
That is a very big subject, but I will just outline it. So it depends on the causes. Now somebody has a wax or osteoma of the ear canal that is blocking the sound. You remove it either in the clinic or surgically, the person starts hearing well. He has a eardrum perforation, you repair it surgically by doing ear grafting. The person is able to hear nicely. A child has a ear fluid, you treat the adenoids, you put a small grommet, you remove the eardrum, the child is going to hear 100% towards normal when you do it in good time. Somebody has a congenital, like an issue with the cochlea. If the cochlea is okay, cochlear nerve is okay, you do a cochlear implant, he is able to hear when you do it in good time, before the age of 5 years. That is the importance of diagnosing it early. Now in old age people, now age related hearing loss is there, so they start hearing at higher frequencies and coming to lower frequencies. So for them, hearing aid might be the best solution. Now again in Western countries, somebody a person who is more than maybe 70-80 years has 90 decibel hearing loss, then for those people also they can go for a cochlear implant. So depending on the cause, most of the causes are either medically treatable or surgically treatable, and rarely now something is there, like somebody is born with no cochlea. There is no cochlea, and then it's really difficult. Now people have found, but in Kenya or even I will say those are quite rare surgeries. Like they do a direct brainstem implant, but those are rare things. But technically it is possible. But common things, we treat them adequately. We are able to treat them to restore the hearing.
What are these devices sometimes you see people with on the sides of the ears?
No, you are talking of the hearing aids or the cochlear implants?
Aids. Something can be stuck on the side of the ear and it's going inside.
The hearing aids are of different. Basically, hearing aids, they amplify the sound. Suppose I have a hearing loss of 50 decibel. So what they do, I'm talking to you in 20 decibel, so they amplify up to 50 decibel. So you will be able to hear the sound. So there are different types. Behind the ear, what you are seeing is the behind the ear. Now there is inside the canal a small device, and there is even CIC, like completely in the canal. So you will not see from the outside. So depending on the circuit, the IC they use, the size becomes smaller and smaller.
All right. I think we are going to stop there because of time. Thank you so much. Where can people find you for these services?
I work at MP Shah Hospital. Our clinic is located in Doctors Plaza, 2nd floor in MP Shah Hospital.
Pleasure. Thank you so much for your time.
Thank you.
It's been great having you.